Dr. Raju's VisionTree Oration 2025, Netracharya Dr. N. Venkatesh Prajna, a scholar with vision, a surgeon with grace, a leader with quiet strength, and a mentor whose footsteps become pathways for others. For a life dedicated to refining sight, uplifting minds, building institutions, and nurturing a culture where excellence and empathy coexist. Your wisdom has shaped practices, your humility has shaped people, and your steady presence has shaped the future of eye care. In every cornea you healed, in every student you guided, in every idea you seeded, there lives a legacy, gentle yet profound, measured yet lasting. With gratitude for the light you have carried and shared, we honor you not merely for all you have achieved, but for all you continue to inspire. Please come and accept the citation from Gopal Raju sir and Ramana.
Good morning, everyone. And this is a different audience for me. This is not my usual audience. Here I see mixed group of people. I see Dr. Vijay Babu sir here, who has seen me as a schoolboy, going to school and coming back when he was one of the first medical officers at Aravind. I see Dr. Srinivas sir, again, who has seen me as a medical student, where we used to see him in awe with his cataract surgery. And I've learned from two of my senior fellows, Dr. Gopal Raju sir and Dr. Madhukar Reddy sir, who were at Aravind when I was a postgraduate, and Dr. Sujata madam, from whom we all learned orbit. So that is one mix. And I have a second mix of people whom I have trained. I see a lot of people from my postgrad for whom directly I have taken lectures and groomed them to be postgraduates, fellows, and also indirectly through my textbooks. From what yesterday, I was very pleasantly surprised when few of the postgraduates came and talked about this DigiNerve and the other app. So I'm extremely honored and happy to be addressing you today, especially the oration being named after one of the visionaries in ophthalmology, Dr. Ramana Raju, and I thank both Dr. Ramana Raju sir and Madhu and Shanti for giving me this honor of doing the inaugural presentation. I want you to see this slide, Dr. Ramana Raju presenting from the Aravind podium. Every Thursday at Aravind, till today, every Thursday between 5 and 6 p.m., we have grand rounds in which we ask overseas doctors, research scientists, people from institutions, and also cutting-edge technologists to present the grand rounds. And this is telecast to all our 13 centers. Around close to 700 people hear this talk every year. Till today, Dr. Ramana Raju has been the only solo practitioner who has been invited to give this grand rounds talk at Aravind. In a world full of surgical carpentry, here is a healer, a fully qualified ophthalmologist who went outside his purview of science, where science was not able to cure a lot of people. He just held the people's hand. It's often said we need doctors. We need doctors who have to transplant a heart, but we also need physicians who can touch a heart, hold the hands of a patient, and take the patient and alleviate the suffering. We salute you, sir, for all the work which you have done as an individual. And I'm extremely, extremely proud and delighted to present this oration which is in your name. So before we actually go into the research, I wanted to keep this thing light, so you don't need to worry about the title, Eminence versus Evidence or Research. It's not going to put you off. I'm just going to keep this very, very light. I just want you to understand the importance of doing research, doing research where we get accurate results. In certain things, we need accurate results because as you can see, the difference between nearly right and exactly right can be very, very tricky depending on the circumstances. This is why we need actual research. And I'll just show you some of the examples which I have gone through personally in pursuit of what I call it as the real truth. So see this presentation, and I'll come back to this slide. Just keep this slide in your mind, and I'll come back to the slide at the end of my presentation. A good research should have all these R's. It should be right, it should be relevant to our country, it should be rigorous, it should be recordable, and it should be reproducible. And all these things, when I started doing research, I had zero idea. I had zero idea about doing research. Somebody asked me to do research, I went in and did research. But then these are the things which has helped me over these 30 years, 35 years of doing continuous research, multiple clinical trials over a period of time, that you need to have certain principles in place where you actively pursue good research. But before we actually talk about research, one thing which you need to really keep in mind is the element of chance. What do we mean by chance? And I'll give you an example. We often are told that lightning never strikes the same place twice. The chance of lightning hitting a person one time is very less. It's 1 in 15,300. The chance of lightning hitting a person twice is 1 in 9 million, almost impossible. And I'll just tell you a story, a real story about this gentleman, Major Walter Summerford. He was in the British Army. And when he was fighting in World War I, Belgium, in 1918, he was struck by lightning. When he was struck by lightning, he was hospitalized for a long period of time, and he got discharged from the army. And Canada was a British colony at that point of time, and he went and settled down in Canada. And while he was taking a walk in Canada 6 years later, he was struck by lightning once again. He was just Initially, at least he was in war, then he just went for a walk. And during a walk, he was actually hit by lightning in 1924. 1930, again, after all this time, he had a mild hemiparesis, and after all this time, he went for a walk. Again, I don't know why he's still going on a walk after 2 lightning hits, but he did go on a walk, 1930, got a 3rd hit by a lightning. And this is what chance is all about. And the story doesn't end here. He died in 1932. He was buried in Mountain View Cemetery in Vancouver, Canada. And in 1936, the lightning struck his gravestone. And this is a true story. I really want you to understand the importance of chance. The chance may be less, may be more, but it is there. That is what research is about. And if you understand this concept about research, 80% of your concept of understanding research is over. So this is one thing which you need to understand this. I always allure to this slide. I want this as my compass when I'm doing research. Whether I'm doing relevant research, of course I'm doing relevant research because India is an agrarian economy and my field of interest is infectious keratitis, mainly fungal keratitis. And it's extremely relevant. If we are not going to do research, who is going to do research for these farmers? So in that way, I'm actually, question myself. I had a very good answer to pursue my research in infectious keratitis. These are just my publications. I've just taken only from the top journals, AJO, Archives, BJO, in all the thing related to infectious keratitis. So what I did was actually, I sort of looked at the economic impact, confocal, drug trials, and all these things. And I want you to promise that I'm not going to bore you with many of these studies. I'm just telling you about my journey, which resulted in so much of these publications, actually prompting JAMA Ophthalmology to include me in their editorial board as an advisory board because of all these publications. And this is my basic research interest of publications in this field of infectious keratitis. This is 30 years of work, 30 years of focused work from a small city in Madurai, where you can really make an impact if you are able to pursue with a single-minded concept. But for today's talk, I'm just going to take 2 of those publications. Well, I'll just show you, when I just show you in the next 10 slides, it just tells, this is a typical part of a research journey. And I'll just explain to you what I mean by a typical part of the research journey. And this is about the conventional cross-linking as an adjuvant therapy for bacterial keratitis as well as for fungal keratitis. And let me start with bacterial keratitis. Suddenly, isolated case reports came up which said cross-linking works for the treatment of bacterial keratitis. This is how news starts. One paper comes as a case report, then sporadic case reports come in multiple papers, then it becomes a case series. And what happens is, over a period of time, people become have so much belief in this. A brilliant paper came up, it said, you don't even need antibiotics. Everything gets resolved with only cross-linking, and this got published in a peer-reviewed journal. So I'm not telling this as an isolation, but I'm just telling you how research gets swayed. An idea comes, floats around, and then multiple people catch on that idea, and then they think that that is the truth, and then floats around before somebody really brings in a scientific rigor and sees whether it is true or not. So what we did was meta-analysis and everything came, but then very clearly there was a need for doing a randomized control trial. A randomized control trial we did with 280 patients. We did not do with 1 patient, 2 patient, 3 patient. We did with 280 patients. We randomized into 3 groups. We really wanted to see whether an adjuvant cross-linking helped in bacterial keratitis. And this was our publication. There was no evidence of benefit of cross-linking versus sham, and this was for bacterial keratitis. Some evidence that in fact cross-linking increases scar size, and we published this in very recently this year in JAMA 2025. So, but before this, for almost 14 years, the story was that this was working. In fact, you don't even need to use antibiotics. The drugs are really not required. Just simple cross-linking might work. So you really need to do some very good RCTs to actually prove or disprove a point. So I'm sure you recognize this gentleman, and there are 2 or 3 stories around this paper. We wanted to see whether cross-linking works for fungal keratitis. And this was published in American Journal of Ophthalmology, and you see the first author here. This first author has a unique capability as sort of this thing. He had never published anything in regional journal, national journal. The first journal he published was as a first author in American Journal of Ophthalmology. So that is a smiling Madhu in that thing, but he only knows how much of hardship he had to go in my hands before he got it right to have his name as the first author in an AJO paper. Now Madhu and I designed a study, a simple study to see whether this cross-linking works in fungal keratitis. And what very clearly said is, this was a study with only 13 patients. I told you 200, 300 patients in the last study. Here we had only 13 patients. And very clearly when we use cross-linking, you see the perforation was 4. And when we don't use cross-linking, there was no perforation. In fact, cross-linking in fungal keratitis was working very, very, very badly. So that was Madhu's contribution to global literature in 2017, and everybody became quiet after Madhu's publication. Nobody really took it up before somebody else came up. But I just want to tell you, I gave you an example of a 300 number thing in the previous study, and I gave you a 13 number in the second study. As long as your questions are right, as long as your methodology is right, as long as your results are reasonable, you can even publish with 6 or 7 cases. And that too in a very reputed journal like American Journal of Ophthalmology. Now Madhu's journey to Aravind was not that as the first author. In the US, you would know that before you go to college, your parents take you on a tour to many universities. They take you, this is Brown University, do you want to study here? This is UCSF, you want to study here. This is Miami University, you want to study here, and the kids tend to choose. Ramana Raju Garu took both Madhu and Shanti to Aravind Hospital when they were in nursery school, especially Shanti. And this was their first journey in Aravind Hospital, and now you understand why I'm standing here before this pedestal. Their journey to Aravind Hospital started way back. I think Shanti must be 3 or 4 years. This thing, and Madhu came with a full vigor and had his first publication. So I was just trying to enmesh this whole story into this whole concept of research. Research that was his paper, and that was this thing. So everything sort of was quiet after Madhu's paper, and suddenly from the Bascom Palmer group, they said, okay, we understand that the cross-linking does not work for fungal keratitis, but we've developed a new type of a cross-linking called Rose Bengal activated, use Rose Bengal and green light. As you know, conventional cross-linking, we use ultraviolet light and riboflavin. Here, they wanted to use rose Bengal and to see a green light. And this was actually from Guillermo Omesca, who has become a very good friend. And he said in this paper, a successful RBPDAT was achieved in 72% of the cases. This was published in American Journal of Ophthalmology 2019. And then they said 72% of the cases, if you use RBPDAT, it works. So we were pretty interested because fungal keratitis is a big problem. So let us do our study. And we did 330 patients of enroll. And here is what rigorousness means. For getting 330 patients into a good clinical trial, you really need to screen 1,342 patients. And that is the importance of rigorousness in a clinical trial. If you want the world to agree to your results, or if you want the world to endorse your results, you really need to show power in, not power of shouting and talking, but you need to have the power in your study to sort of make the world look at you with renewed interest. So we did 330 patients. We said maybe the cross-linking was not working. Let us do a reagir. Let us do a rose Bengal and a green light. 165 in each. And we were still unable to demonstrate a benefit for rose Bengal photodynamic antitherapy after all this thing. And this, it says ophthalmology, it also got published in ophthalmology in 2025. But what we did find was, if you take fungal keratitis as a group, there was no benefit. But there was some evidence of interaction between fungal organism and treatment arm, which may indicate fusarium ulcers may benefit than aspergillus ulcers. We never knew. We always knew that for bacteria, gram-positive bacteria, gram-negative bacteria, two different treatment. We never knew that for fungal ulcer that you required two treatment. Then we went ahead and looked at these patients. Why were they able to get 72% good results? Then we found out, when we looked at the methodology, only fusarium, no aspergillus. So this is the importance of going through the methodology of a study. If you just look at the conclusion and the aim of a study, then you might not get the correct result. And see, in this group, there was no aspergillus, only fusarium, and probably that was the reason why you got a good result in that study. So, do we need to consider differential treatments for fusarium and aspergillus? We always had these results. In fact, from our lab, both these studies are from our lab in 2006 and 2014. The aspergillus ulcers had an increased risk of perforation, worse visual acuity at 3 months, and corneal infection associated with lower epithelium. The mud study, which we did to just see, compare natamycin and voriconazole, also showed that if you take all organisms, just see the first line, natamycin was better than voriconazole, 2 lines better. But if you take fusarium, it's 4 lines better. So something is happening with the fusarium ulcers versus an aspergillus ulcer, which we didn't know so far. In non-fusarium cases, there was not big difference between natamycin and voriconazole. Why am I telling this? This is, you have to look at the methodology of any paper very carefully. We don't read the methodology because it is sort of has a lot of numbers and all these things. But that study result of any paper is pertinent only to that methodology, and so you have to interpret those results with caution. Now, I was also saying, with all these things, whether the results which you have obtained is reproducible in another lab. Very luckily for me, I had a paper out of L.V. Prasad, and Savitri Madam had published this. And this was done independently. Arvind was not involved in this study. Very nice topic. They used the word reappraisal. I didn't believe my own results when I said natamycin, which was discovered in the 1960s, was a better drug than voriconazole, which was discovered in 2002. So naturally, Madam was also doubtful. So she said reappraisal of topical 1%. And then this got published in the British Journal, and she also said when compared with voriconazole, natamycin was more effective in the treatment of fungal keratitis, especially fusarium keratitis. And this cements the result of a study, the reproducibility, when it is being done in a completely different environment by a completely different set of investigators. So what was the impact of such study? The impact of such study was you can do a clinical trial in a small city at Madurai and you can influence the treatment across the world if you do it right. And this was a very big thing because people who know Moorfields know that they don't change very easily. Moorfields has got its own way of thinking. It's different from UK's way of thinking also. But then at Moorfields, the other thing which is very, very pertinent is UK was not manufacturing natamycin. UK was manufacturing only voriconazole at that point of time. Based on a study out of Madurai, for 9 months, the NHS imported natamycin from Canada. And that was a very big cost to the NHS, but they did it because they really followed up the results of a clinical study. So it was actually carried out in press that research out of Madurai influences a UK treatment protocol if you actually do it right and well. And that too, in another hospital, Wills, which also sees a lot of infectious keratitis, they also said, after MUT results have been published, this is what we treated our patients with. Very importantly, the Cornea Society is an international organization. They did an expert opinion in 2007 amongst their members across the world. 80% preferred voriconazole, while after the MUT study results were published worldwide, 70% preferred natamycin. And this is, once again, the power of a well-conducted research study where you can really move the compass wherever you are. So, I started my career by asking which treatment option is better. And I ended up with a result which said different fungi respond to different treatment modalities. Now, this is something which you need to understand your research. You might start off with a question, but if you do it perfectly well, that study will throw up answers from which you take a cue and then go to the next level and to actually position your results in a much different way. And some of the times, these study results, when it comes out, people will not believe you. People will not believe you, and this is what the chairman of IBM, IBM is a very, very big computer company. When the computer was discovered in 1943, the chairman of IBM thought there's a world market for maybe 5 computers. So this is a statement made by the chairman of IBM. So we don't know. At this point of time, we just don't know the magnitude of what is going to come. And we just need to be open enough to be accepting certain things which are there, which are being coming out scientifically, to see the relevance of it and to also accept it. And this was also very nice. Alexander Graham Bell was very excited when he discovered the telephone, and he went and told to the president of the US. Rutherford Hayes was the president of the US. And he said, the president was very encouraging to the researcher. He said, this is an amazing invention, but whoever would want to use it? There are horses, there are messengers. You can easily send them through this. Who would want to use a telephone? So these are real things which happened in history. And this is what I really need the young doctors to keep your eyes open. You might think, you might have something that this is working, but you'll be so scared to tell it out because the world shouts you down. But the only thing you require is conviction, and after that, a courage to do a very well-embarked research trial from which you can really shape the world. Just because you can't find anything, it doesn't mean that it is not there. Maybe you are not able to find something at this point of time. You ask a question. I'm throwing up this question here in this audience. Somebody in this audience, some young doctor in this audience may take it up from here. And then it's like a relay race. You take it, you hand it over to the next person. That's how research is all about. It's all about collaboration. It's all about taking it to the natural conclusion. So I was showing you this slide at the beginning. Actually, it's a mix of many different types of formation of rocks. But if you see from a distance, it looks as if somebody is, it's like a sculpture. Somebody is reading. Actually, it is not. It is just aggregation of stones. It all depends from where you see the stone. It all depends from which distance you see the stone. And that is how your perception, your mind would make you think. And this is where you really need to have your own conviction when actually you're doing a research. Research, evidence-based research helps develop protocols. It's very important. Why is this important in our country? North India and East India has aspergillus. South India and West India have fusarium. Together they are called as fungal keratitis. But somehow aspergillus needs a visa to come to South India. You know, it's something very clear demarcation. Multiple laboratories have found it. So it is very essential that we look at microdata before we really prescribe research for our patients. It reduces costs because you don't throw all type of medicines into one eye. It optimizes treatment and builds up ideas for the future. So actually, that is one part of me about research. And I was always questioning myself, okay, I'm doing research. What about the patients who are coming to the hospital today? What best I can do to take care of so many corneal ulcer patients who come today. And I'll just show you a video of my other part, which has got nothing to do with research.
பாட்டி இந்த மருந்தெல்லாம் போட்டுட்டு 2 நாள் கழிச்சு எங்களை வந்து பாருங்க சரியா?
A healthcare provider's responsibility does not stop with diagnosing the condition and offering a prescription. Aravind, along with partners like GBS, goes an extra mile and gives free medicine and money for transport of patients and attenders till the ulcer heals.
Over a period of time, I came to realize that a prescription never cures a disease. You can have all the resources in the world. You can have all the intellectual knowledge. You can have all the results from a clinical trial. Effective implementation is the key. And I came to realize that without implementation of the knowledge, it just doesn't mean anything.
Instead of that expensive prescription, which they all feared, free drugs were directly handed to the patient, along with the money to meet their travel expenses. This encouraged them to come for regular follow-up and put life back on track for Thenmuli. Even the junior-most staff at the clinic is given the freedom to educate such beneficiaries about the treatment schemes. The quality of giving is ingrained into every member of the team.
Thank you so much for the entire Arvind Hospital team. அந்த கண்ணு மாற்றி எப்போ பாடு வந்து நார்மலாக நல்லா தெரியுது.
Ultimately, it is faith that cures.
What it effectively means is we have flooded the families with optimism, with courage, and we have also stood by them during this time of crisis, especially in the whole era of pessimism which surrounds their everyday life. And it often reminds me of Dr. V's words. He used to often say, it is ourselves we are helping, it is ourselves we are healing. And it's a very, very nice feeling to have for me. So, actually, I write textbooks. Many of the postgraduates here know my textbooks. I make a lot of royalty money. I didn't know that you could make so much of royalty money. For the older individuals like me, I created a digital textbook. You know how much it has sold in the past 3.5 years in India? For almost 16.5 crores, not lakhs, crores. So again, a postgraduate is willing to spend money. Many of the teachers here might not know, your postgraduates are having that app. So you create something which is of interest to the population, and the entire royalty money from that goes to this. So in that way, I feel better. You know, it's just not doing research for research sake. Of course, you have to do research. You can influence the world through your research. But what happens to the individual patient who comes to your clinic tomorrow? So that is the power at which you can mesh all these things at your hand. You are much, much more powerful than what you think you are. If you are able to get that idea inside you, inside the young minds, then our job is very well done. I want to acknowledge all my partners in my research study. We do with many. I currently have 5 R01 grants at the NIH. NIH getting an R01 grant is difficult, but then I have 5 R01 grants with 5 different universities with whom I'm able to partner in different facets of research. But ultimately, at all of us at Aravind, this is our favorite quote. With all of this, intelligence and capabilities are not enough. There must be the joy of doing something beautiful. And once again, I would like to thank Dr. Ramana, Raju, sir, and Dr. Madhu for giving me this opportunity to share some of my experiences in research and in patient care for this audience. Thank you very, very much.
Thank you, Prajna. That was a wonderful share of the wisdom, really eminence, evidence, and supported by the data and the practical video. Thank you very much, sir. I request the audience to give him a standing ovation. Thank you all.
In continuation to what sir has just told, whatever royalty goes to the ulcer trials. As part of our journey also, we have got very special signed books of payment edited by sir himself to give it away to all the medical colleges in Vizag. I first request Jyotirmay madam from Regional Eye Hospital to please come out to the dais to collect the signed copies of the latest payment. Please, madam.
And since Madhu mentioned this, this is again a very special moment for me. When I studied post-graduation, there was no Kansky. No Kansky. The only international textbook we all read was Payment. And never did I think that 25 years later, I would become the chief editor of that same book, which I studied for my post-graduation. And I feel very proud to do this.
I request Lalit Verma sir, Ajit Babu sir, and GC Garu to please come out to the dais while we hand over these books. Next, I would request Amma. Agandi. Next, I request VVL Narasimharao sir from Geetham Medical College also to collect the books for the library. Background. Thank you. VVLN sir from Geetham Medical College. Next, R. Surnaran Raju sir and Tarkeswarao sir from Gayatri Medical College. R. Surnaran Raju sir and Tarkeswarao sir. And next, Dharmaraju sir from NRI Medical College. Gopal Raju sir, please join. Dharmaraju sir from... Yeah. Dharmaraju sir. Sir, mirror. Okay. Next, I also request Gopal Raju sir to collect it on behalf of Vishaka for the DNB students. And I should acknowledge that sir has been kind enough to allow our EON resident to attend the classes there. Thank you, sir, for encouraging us and guiding us in every step. So on behalf of Vishaka Eye Hospital, Gopal Raju sir for DNB students. Dr. Mamata from Sankar Foundation. Dr. Mamata, on behalf of Sankar Foundation, please come and collect your copies for your DNB residents. Dr. Mamata. Dr. Shanti and all the kids from VisionTree for their DNB residents. Thank you. Dr. Shanti, Dr. Vaishali, please come out to the dais. Ellen. Go. Sudhakar, Vaishali, please go and collect for our DNB residents also. Thank you. Thank you so much, sir. Now I request Ramana Raju garu to give away a small memento to Gopal Raju sir for chairing the session, along with Prajna sir. Photo moment. Thank you, sir. Thank you for chairing the first session and also, most importantly, helping us in every step of our journey in VisionTree, right from the starting. Yeah. I request Ramaraju to come and have a photo with Prajna sir. Please. Yeah. Ramaraju sir to give it to Prajna sir. Yeah. Thank you.